Embrace Stretch Marks is the only management system designed to relieve the tension that causes stretch marks. It's the only product of its kind working to improve the appearance of stretch marks. Embrace works best on red or pink-colored stretch marks. The earlier you treat, the better your results. Items you may need include a disposable trimmer or scissors, washcloth, soap, alcohol wipes, and mirror. For best results, we recommend applying at night at least 2 hours before bed. Use a mirror for guidance and avoid bending to look at your stretch marks while applying Embrace. Bending over to check the dressing during application could add excess tension and make wearing Embrace uncomfortable. Gently cleanse the area surrounding the stretch marks with a washcloth, soap, and water. When possible, use bar soap. If your hairline is within the application area, please trim or cut the hair using a trimmer or scissors. Do not shave the area, as this can cause irritation. Next, remove any oil or soap residue with alcohol wipes from the area surrounding the stretch marks. Be sure to allow your skin to dry before applying Embrace. To begin, place your thumbs in the middle of the applicator and gently open. Fold the side of the applicator with a dark stripe all the way back. Hold the applicator on the outside to avoid touching the adhesive. Hold the applicator, adhesive dressing side up on the ends so that it sits between the thumbs and fingers. Gently bow the applicator as shown. This will ensure the dressing has no pockets or creases before you apply it to the stretch marks. Position the applicator over the stretch marks as shown, with the visual guide dark stripe facing away from the body and parallel to the stretch marks. Use the notched area between the tabs and the visual guide to help center the dressing over the stretch marks. Make sure stretch marks are completely covered. The dressing should extend at least 1/2 inch beyond each side of the stretch marks. Press and hold the applicator on the skin for 30 seconds. As pressure is applied, the dressing will adhere to the skin. Make sure to press down firmly on all edges and corners. Continue to hold the applicator firmly in place with your fingers alongside the dark stripe. With the other hand, pull one tab to the side and along the edge of the applicator. While maintaining pressure, repeat the steps for the second tab to release the dressing from the applicator. Before removing the applicator, rub each of the vertical bands on the applicator one more time. Lift the applicator from the skin. The dressing will remain in place over the stretch marks. Check the dressing to make sure it's evenly attached. Use hands and fingers to help smooth out any uneven areas, release any air pockets, and ensure all corners are adhering to the skin. For stretch marks larger than a single dressing, additional dressings may be used for complete coverage. Apply first dressing in the middle of the stretch marks. Working outward, center the next Embrace dressing over the uncovered part of the stretch marks. Ensure there is an overlap of the two dressings to prevent irritation. Repeat these steps until the stretch marks are completely covered. Allow 2 hours before wearing tight or restrictive clothing and at least 4 hours before showering or physical activity. Each dressing lasts an average of 10 days and is then discarded. Certain applications may involve more frequent changing due to high mobility, cleansing routine, hair growth, or oil level on the skin. For best results, continue treatment for a minimum of 60 days. Important things to remember. After application, a minor wrinkly or wavy appearance in the dressing is normal. Minor skin redness is okay. Embrace is water resistant, not waterproof. We do not recommend taking baths or swimming. Showering is okay. Moisture or condensation under the dressing is okay, such as after showering. Do not apply compression garments or binders for 1 to 2 hours after application. If you have redness or irritation around the edges of the dressing, reposition it higher or lower to avoid direct contact with the irritation when applying the next dressing. If you have an allergic reaction or blistering, please consult your physician. Dressing removal. Medical-grade adhesive is designed to last, so slow, gentle removal is important. Wait to remove dressing until dressing begins to loosen on its own, typically around 10 days of wear. Baby oil and a cotton pad may be used, but warm water and soap are typically all that is necessary. You can also use adhesive remover if desired. You may also choose to remove embrace in the shower. Holding a corner of the dressing, begin by gently peeling it back at 180 degrees or rolling it upon itself. Use your other hand to apply slight pressure on your skin while gently removing the dressing. Do not pull quickly, as skin irritation or tearing can occur. If your stretch marks require multiple dressings to cover the area, begin with the dressing that lays on top. Repeat the process, working your way towards the first dressing applied. Upon removal, cleanse with soap and water, gently removing any remaining adhesive or baby oil. To prepare for the next application, trim any hair in the area that could prevent embrace from adhering to the skin. For best results, we recommend allowing the skin to rest 12 to 24 hours before the next application. To order more product, visit EmbraceScarTherapy.com. If you have any additional questions or concerns, please contact customer service at 1-855-722-7879.